Hey guys, welcome to my channel, Not Just a Medico. In this video, I'm gonna tell about all the important questions of biomechanics which were repeated in your previous year question papers. If you're thorough with all these important questions, then I'm pretty sure that you will not only pass but you can even score really good marks. So without any further delay, let's get into the video. But before starting the video, let me tell you guys that there might be few printing mistakes, so I'm gonna dictate all the questions, so do not skip the video. Okay, so let's start with the chapter 1. In this, first let me complete 5 or 10 mark questions, then let's start with the 3 marks questions. In 5 or 10 mark questions, the first question is define force, components of force, add a note on concurrent force. The second question, define lever, explain various orders of lever. Third one, Newton's laws of motion. Fourth one, open and closed kinematic chain, explain with examples. Fifth one, explain force of friction and its significance in physiotherapy. Sixth one, list all planes and axes. Seventh one, kinetics and kinematics, explain with examples. And here there are page numbers in front of the questions which I had written for my own preference. You can refer or you can even skip it. Okay, next the 8th question is define equilibrium, discuss types of equilibrium with examples. 9th one, types of friction with example. This was about 5 or 10 mark questions. Now let's start with the 3 marks questions of the first chapter. The important 3 mark questions in the first chapter is the first one, define force of friction and its types. Second one, mechanical advantage. Third one, define axis and plane. Fourth one, kinetics and kinematics. Fifth one, explain Q angle. Sixth one, anatomical pulley with example. Seventh one, angular velocity. Eighth one, mention the uses of pulley. Ninth one, define moment arm of force. 10th one, define COG and LOG. Next, the last question, that is the 11th one, is define work and energy. So this was all about the first chapter. Now let's start with the second chapter with 5 or 10 mark questions. The first one is write in detail the properties of connective tissues. Second one, classify diarthrodial joint and give example of each. Third one, describe the features of synovial joint. Yes, there's a printing mistake in this question. Next, the fourth one is classification of joints. Fifth one, define pulley. Enumerate various pulleys present in the human body. Sixth one, load deformation curve. Seventh one, joint lubrication models. Eighth one, concave convex rule with example. Ninth one, diarthrodial joints. 10th one, arthrokinematics. 11th one, explain types of arthrokinematics with examples. 12th one, osteokinematics. 13th one, types of lubrication in synovial joint. 14th one, properties of bone tissue. 15th one, stress and strain. 16th one, explain prime movers and stabilizers. This was about the 5 or 10 mark questions. Next, let's start with the 3 marks questions. The first one is what is creep and relaxation. Second one, angle of torsion. Third one, angle of inclination. Fourth one, what is loose packed position of joint. Fifth one, what is closed packed position. Sixth one, stress strain curve. Seventh one, anteversion and retroversion. Eighth one, define arthrokinematics. Ninth one, define Hooke's law. 10th one, give 2 functions of connective tissues. 11th one, viscoelasticity. 12th one, isokinetic muscle contraction. 13th one, concave convex rule. 14th one, what is Young's modulus. 15th one, contents of hyaluronic acid. Okay, now we are done with the second chapter. Let's start with the third chapter now. In this, the important 5 or 10 mark questions are: first one, mechanism of muscle contraction. Second one, different types of muscle contraction. Next, the important 3 mark questions of the third chapter are: first one, classify various muscle fiber. Second one, write the name of muscle proteins. Now let's get back to the 5 or 10 mark questions again. Continuation. The third question is active and passive insufficiency with example. Fourth one, structure of motor unit with diagram. Fifth one, functional unit of muscle, types of muscle fibers. Sixth one, what is biarticular muscle? Explain active and passive insufficiency. Seventh one, length tension relationship of muscle. Eighth one, features of tonic and phasic muscles. This was all about the 5 or 10 mark questions. Let's continue with the 3 marks questions again. The third question is agonist. Fourth one, what are the factors that affect the muscle function? Fifth one, spurt and shunt muscle. Sixth one, concentric and eccentric contraction. Seventh one, DOMS, that is DOMS. And finally, we are done with the third chapter also. Now, let's start with the next chapter, that is vertebral column. In this, the important 5 or 10 mark questions are: the first one, describe the structure of cervical vertebra and biomechanics of cervical spine. Second one, explain the structure of typical lumbar vertebrae and add a note on function of lumbar spine. Third one, ligaments of vertebral column, stability and mobility of vertebral column. Fourth one, lumbopelvic rhythm. Fifth one, structure of intervertebral disc. Sixth one, structure of vertebrae, add a note on curves in vertebral column. Seventh one, movements of facet joint in vertebral column. Eighth one, mobility of cervical region. And this was about the 5 or 10 mark questions. Next, let's start with the 3 marks questions. In this, the first question is name the ligaments supporting spine. Second one, spondylolisthesis. Third one, mammillary process of vertebra. So yes, this was about the vertebral column chapter. Now let's start with the next chapter, that is thorax and chest wall. In this, the important 5 or 10 mark questions are: the first one, explain in detail about kinetics and kinematics of thoracic rib cage. Second one, discuss in detail about the biomechanics of thoracic spine. Third one, biomechanics of ventilation muscles responsible for ventilation. Fourth one, articulations of thoracic spine and movements of thoracic spine. Next, we have the important 3 marks questions. In this, the first one is muscles of ventilation, and the last one, that is the second one, is name the muscles contracting during normal breathing. And finally, we are done with this chapter. This was quite a small chapter, right? Now, the next chapter is elbow complex. In this, the important 5 or 10 mark questions are: the first one, structure and function of radio-ulnar joint. Second one, carrying angle, explain its importance and function of elbow and forearm. Third one, factors of stability at elbow and mobility of elbow joint. Next, the important 3 marks questions of this chapter are: first one, carrying angle and its importance. Second one, pulled elbow. Third one, at which range of elbow the torque created by biceps is greater. And finally, we are done with this chapter. Now let's start with the next chapter, which is wrist and hand complex. In this, the important 5 or 10 mark questions are: the first one, structure of wrist complex and add a note on functional position of wrist. Second one, difference between power grip and precision grip. Third one, describe types of grip. Fourth one, functional position of hand. Fifth one, biomechanics of wrist joint and explain the muscle work and movement in detail. Sixth one, palmar arches of hand and its significance. Seventh one, analyze various pinches of hand. Eighth one, precision handling. Ninth one, formation of arches in hand and functions. 10th one, extensor mechanism of hand and its function. 11th one, power grip. 12th one, precision grip. 13th one, lateral prehension with example. 14th one, role of intrinsic muscles of hand, and the last one is extensor hood mechanism in hand. Next, the important 3 marks questions are: the first one, functional position of wrist and hand. Yes, this is repeated. Second one, what are the movements of first carpometacarpal joint. Third one, what is thumb opposition? Fourth one, annular pulleys. Fifth one, carpal tunnel syndrome. Sixth one, right muscle work in hook grip. And the last one is functional significance of palmar arch. And finally, we are done with this chapter also. Now, let's start with the next chapter, which is hip complex. In this, the important 5 or 10 mark questions are: the first one, ligaments of hip joint. Second one, explain bilateral and unilateral stance. Third one, lateral pelvic tilt. Fourth one, forces acting on hip in unilateral stance. Fifth one, stability in hip joint. Sixth one, pelvic tilt. Seventh one, use of cane in hip joint when given on the contralateral side. Eighth one, sacroiliac joint function and structure. This was about the important 5 or 10 mark questions. Next we have the important 3 mark questions, in which the first one is gluteus maximus gait and antalgic gait. Second one, nutation and counter nutation. Third one, acetabular anteversion. Fourth one, name the ligaments of hip joint. Fifth one, Trendelenburg sign. Sixth one, define angle of inclination of femur. Seventh one, acetabular labrum. Eighth one, femoral torsion. And this was about this chapter. The next chapter is shoulder complex. In this, the important 5 or 10 mark questions are: the first one, structure and static stability of shoulder joint. Second one, dynamic stabilizers of shoulder joint. Third one, kinetics and kinematics of motion with relation to shoulder joint. Fourth one, explain scapulohumeral rhythm during elevation through abduction of shoulder complex. Fifth one, list out joints forming shoulder complex and explain ligaments. Sixth one, describe the structure and movements of acromioclavicular or sternoclavicular joint. And yes, we are done with this chapter. Now, let's start with the next chapter, that is the knee complex. In this, the important 5 or 10 mark questions are: the first one, ligaments of knee joint. Second one, explain in detail the screw home mechanism of knee joint in weight bearing and non-weight bearing positions of knee joint. Third one, knee complex and locking mechanism of knee. Fourth one, unlocking of knee in weight bearing and non-weight bearing. Fifth one, tibiofemoral meniscus. Sixth one, static and dynamic stabilization of knee. Seventh one, extensor mechanism of knee. And the last one is patellofemoral joint. Next, the important 3 marks questions are: the first one, grasshopper eye patella. The second one, any 2 functions of cruciate and collateral ligaments of knee. Third one, index of insal and salvatae. Fourth one, genu varum and valgum. Fifth one, movements of patella. Sixth one, patella plicae. Seventh one, which knee joint ligaments contribute to anterior and posterior stability and how do they provide stability. Eighth one, what is genu recurvatum? Ninth one, name the bursa around the knee joint. 10th one, name the ligaments which provide medial and lateral stability to the knee joint. 11th one, role of menisci at knee. 12th one, genu varum, and the last one, that is 13th one, genu recurvatum. And finally, we have come to an end of this chapter. Let's start with the next chapter, that is the ankle and foot complex. In this, the 5 or 10 mark questions are: the first one, goniometer measurement of ankle range of motion. Second one, supination and pronation twist. Third one, structure and function of plantar arches. Fourth one, biomechanics of subtalar joint. Fifth one, formation of plantar arches. Sixth one, deviations occurring at ankle joint. Seventh one, metatarsal break. Eighth one, stability of ankle joint. Ninth one, arches of foot and various deformities. And the last one is static and dynamic stabilizers of ankle mortise. Now coming to the important 3 mark questions. In this, the first one is hallux valgus and hammer toe. The second one, center of pressure. Third one, plantar aponeurosis. Fourth one, supinated foot. Fifth one, ligaments of ankle joint. Sixth one, index plus minus foot. Seventh one, give two uses of plantar arches. Eighth one, pes planus. Ninth one, what is metatarsal break? So yes, this was all about this chapter. Now let's start with the next chapter, that is posture. In this, the important 5 or 10 mark questions are: the first one, define posture and factors affecting posture. Second one, sagittal plane analysis of posture. Third one, types of posture. Fourth one, explain the strategies controlling posture. Fifth one, deviations from normal posture. Sixth one, posture control. Seventh one, ideal posture from anterior and lateral directions. Eighth one, kinetics of posture. Ninth one, effects of pregnancy on posture. And the 10th one is static and dynamic posture. And let me tell you guys that this chapter is not only important from the theory point of view, but it is very important for your practicals also. And if you guys want to know that which are the topics which are important for your practical point of view, then do let me know in the comments below. I will try to make a separate video on this topic. Now coming to the important 3 mark questions. In this, the first one is name the various methods to assess posture. Second one, types of posture. Third one, postural deviation in sagittal plane. Fourth one, list 2 postural deviations seen in frontal plane. Fifth one, explain good and bad posture. And the last one is, where does the line of gravity pass through the spine? And finally, we are done with this chapter. Now let's start with the next chapter, that is Gait. In this, the important 5 or 10 mark questions are: the first one, define gait and determinants of gait. Second one, pathological gaits. Third one, events in stance phase of gait cycle. Fourth one, analyze and write the lower extremity joint motion during stance phase. Fifth one, biomechanics of walking. Sixth one, distance and temporal variables of gait. Seventh one, gait cycle. Eighth one, energy expenditure during normal gait. Ninth one, swing phases of gait cycle. And the last one is circumduction gait. And yes guys, this is another important chapter for your practical examination. Now let's start with the important 3 mark questions. In this, the first one is center of pressure and degree of toe out. Second one, antalgic gait. Third one, degree of toe out. Fourth one, gluteus medius gait. Fifth one, walking velocity. Sixth one, what is characteristics of gluteus medius gait or Trendelenburg gait? Eighth one, what is gait cycle? And the last one is define step length and stride length. And at this point, I know some of you might feel that these questions are actually more, but trust me guys, these are very important questions which are taken from your previous year question papers. So you should not skip any of these questions. But when you actually study the whole textbook, you feel that these questions are actually less. But I can assure you that you can score really good marks, and this is only possible when you are perfect with all these topics. And yes guys, I know sometimes the pronunciation may differ, so if you find any difficulty in understanding my pronunciation or if you have any other queries, then do let me know in the comment section below. And now I'm gonna give few questions from the most important topic, which is more important for your practical examination, but at the same time it is important for your theory exam as well. So the most important topic is goniometry. In this, the important 5 or 10 mark question is define goniometer, principles and measurement of goniometer. Next we have moment analysis questions. These are very important for your practical exams but also theory exam as well, but it is mostly important for your practical exams. In this, the first question is movement analysis during sit to stand activity. Second one, movement analysis of lifting. Third one, movement analysis of standing to squat. Fourth one, movement analysis of standing to sitting. And fifth one, stair climbing. So finally, we have come to an end of this video. If you find this video helpful, then don't forget to like, share and subscribe to my channel. I'll meet you guys in the next video. Till then, take care.